That was an anxious moment. I wasn't sure we were going to go live there for a minute. So I'm going to say hello to everybody. Depending on where you are in the world, either good morning or good evening. It's 7 p.m. in Queensland, Australia at the moment, but I know we have people from all around the world, and we welcome you from wherever you are. Today we're going to talk about something that's really close to everyone's heart, I think, at the moment, with COVID-19 literally taking over everybody's lives in all sorts of ways. The Don't Forget the Bubbles team have constructed a lovely panel for us to talk to about our own wellbeing today. And we're going to start off just by getting everyone to introduce themselves, just in a quick sentence or so, why you're here and why wellbeing is important to you. Shweta, do you want to start off?
Sure. So my name is Shwea Gidwani. I'm an adult emergency medicine consultant, and I'm based at Chelsea and Westminster NHS Hospital in London. I'm also part of a global EM community and support development of global emergency medicine in India. And I have a virtual fellowship specifically looking into doctors' well-being in the front line. So I'm quite passionate about this.
Okay, welcome. Do you want to go next? Is it Alys? Is that how I say it?
Alys.
Alys. Sorry, Alys.
Thank
We've
you.
obviously just met. Do you want to go next?
Well, yeah, good morning to people in the UK and obviously good evening to everyone else. And I'm so grateful that you invited me. Thank you. I am a liaison psychiatrist and I work in the Betsy Cadwallader Health Board in North Wales. And I suppose I have a long-standing interest both in compassion, compassionate care, compassion to ourselves, also in staff well-being, and obviously some people may know me more from the work in terms of suicide and self-harm prevention. But at the moment, you know, although I'm obviously worried about everybody, my focus is how can we support our staff. So thank you for inviting me.
No worries. Tessa, most people would know you, but can you please introduce yourself anyway?
Yep, I'm Tessa Davis. I work as a paediatric emergency medicine consultant at the Royal London Hospital. I don't have any specific wellbeing expertise, and I'm on the panel to represent all of the people who are kind of just trying to do their job, you know, as we all are on the front line while COVID is kind of exploding and becoming a bigger problem in the UK, and just trying to balance how we can look after ourselves. But also what we can do for our colleagues and our team that's something practical that might help while we're all getting bogged down with policies and pathways and PPE.
Yeah, exactly. Mary, most people I think should know you from Don't Forget the Bubbles, but can you give yourself a little bit of an introduction, please?
Yeah, sure, Liz. I'm Mary Freer and I live in Adelaide in Australia, so it's evening for me here. I would describe myself as a compassion revolutionary and a social change maker. I'm trained as a social worker and I work with health services across Australia around improving culture and maintaining workforce wellbeing.
Last but absolutely not least, Jane.
Hi, I'm Jane Munro. I'm head of rheumatology at the Children's Hospital, and in the past 2 years I've spent a lot of time looking at clinician wellbeing and health and wellbeing, and I met a lot of these people. But late last year in Victoria we started a Doctors' Health and Wellbeing Network, and then early this year when I saw COVID starting to spread and the doctors and nurses asleep on desk chairs, we decided to start the Pandemic Kindness project, and that has now spread, and we're trying to link in a national network across Australia with the governments of the different states and be able to support health workers of all disciplines to avoid really falling into those traps.
Okay, I guess I should probably introduce myself. I'm Liz Crowe. I'm a paediatric intensive care social worker, and I am one of these days will finish my PhD in staff wellbeing. I'm very close now, but I'm going to blame COVID-19 that it's not actually currently in, and I'll probably milk that for the next 2 years. Okay, so guys, can you give me an indication why you think people are so overwhelmed at the moment with their own well-being? Okay, we'll start with Alys.
I think it's because this is different. I think COVID-19 is personal because we are obviously very worried about our patients and about the citizens we serve, but this affects our loved ones and it affects the people that we care about. And I think it's, if you think about Maslow's hierarchy of needs, the bottom level is not being met.
Yeah.
And I think that's why.
And I would tend to agree. Does anyone else want to join in on that about why we think this is just so different for us?
Yeah, I think you've hit the nail on the head, Alys. Just to add, I mean, just to sort of expand on this being a personal thing, I think people feel very much concerned about their own safety, their families, in terms of, the illness itself. And I'd also add one other thing is the absolute information overload on every channel possible, which we kind of as healthcare professionals want to be open to because it's a new illness, it's a new disease, you want to learn everything about it, you want to be on top of it, you want to be on top of your game, especially if you're providing the care and things are changing on a day-to-day basis. But at the same time, it's utterly overwhelming, the information, and there is no real ability to switch off from it on any channel. So I think information overload being a huge thing as well.
And I'm just going to throw on just into that, just build on that, Shweta. I think both of you totally agree with you. Also, the information is changing, and we're creatures who really like certainty, and we're not able to get a grip on anything that's absolutely certain because everything is changing all the time. And I think that undermines our sense of control. So here we are, we suddenly, not that we really ever had control, but we lived under the beautiful illusion that we had more control. And now we absolutely, there's all these things that we have absolutely no control over. And that's an unnerving kind of experience. And also we're watching it play out across the world. So depending on where you are, in Australia, we probably are experiencing it, like people are saying, it's like the tsunami, the wave has gone back, but in many places nothing's happened yet. So it's eerie because then you look at Italy and the UK and you think, is that what's going to happen?
And I think there's a level of, there's a source of danger. So there's that personal danger, as you said at the start, to your loved ones, concern for patients and then concern personal safety. And I think that, the initial, some of the research that's happened in disasters before, but also in this one that's new, is conflicting about which information source to trust. That's been one of the real ones, and it's changing on a daily basis. And so particularly around PPE, which is one of the key things. And in China, the publication they had, when they actually were able to resolve sleep and PPE, it meant that people's level of anxiety just massively dropped. And going back to basic, Maslow, that basic foundational piece of Maslow. So, I think one of the things, if people are in that heightened sense of anxiety, they can't take things in. They can't take a lot of the psychological interventions in any really detailed way, is what the psychiatrists are telling us. And you can obviously speak to that, Alys. But we really need to go back to some of the basic things and try and supply those, particularly as we go through the different phases also. This is where we need to rely on people that really understand disaster management and pandemic management. And I would be saying, if you're managing your team or you're involved in the trusts or at the, service management, that we are addressing places to sleep, places to rest, safe transport. We're feeding our staff. We're getting them the basics that they need around that, and that we do our absolute best to reassure them about PPE management in a really clear, specific way, and we over-communicate that as much as possible.
Absolutely. I wanted to pick up.
Sorry, can I just add? And I think one of the problems we have here, that even trusted sources of information is changing. And that is absolutely not a criticism. It shows the rapidity of our learning. And to be honest, I think it's incredible that staff who have been involved, in the early stages, have already been collecting data, writing and publishing. And I think that is a huge testament, and we're indebted to them. And I think that obviously adds to the problem, that even people we absolutely 100% trust, that's changing too. Sorry.
Yeah. And I was just going to say, I think the difference is that, normally something happens in a part of the world and we all go, wow, how would our hospital respond to that? Or even when someone comes in and sees us as clinicians, we can empathize, we can use our skills. Part of us could even think, well, that was cool to be involved in, or that was horrendous. And then it's over. But this is different on every front, isn't it? Because we're watching it unfold. We don't know the level of disaster for our particular region, our particular area, our particular country. And it is very personal. And I love those concepts of no certainty, no control, because for the majority of us, certainly not all, there are people who are definitely living in war-torn countries around the world. But for the majority of us, we've never known this level of hardship. We've never known this level of uncertainty. We have people in our teams who've never known the world without Google. Everything can be found on Google. You can understood it. And then all of a sudden, it's like there's a term, assumptive world theory, that we've all had this assumptive world theory that you can be smart enough to be ahead of something, to be ahead of the danger. You can be smart enough to protect yourself and your family. You can be. And this is different, isn't it?
And certainly one of the things that I found really demoralizing, I think it's not so bad now, but the 5th time a row after a very long day at work, I went shopping and couldn't buy the basics.
Yeah.
And we're dealing with that level of difficulty, never mind everything else. But absolutely.
And when you go back to the Maslow hierarchy of needs, those basic things aren't there when you need them most. Can I ask you all perhaps to, just go around and say, if there was one thing that you felt that was desperately needed with regards to wellbeing at the moment, or one thing that you felt very proud that your organisation was currently doing, could you share that with us? Because when you talk about this information overload, and Mary Freer said this beautifully offline to us the other day, it's almost like you're trying to drink out of a fire hydrant, and it's going up your nose, in your eyes, down your mouth, like, and it doesn't matter how fast you swallow, it's going everywhere and you've got no control of it. When that's actually unfolding for us clinically, but then you go to even look at the wellbeing stuff, it's the same thing. Everyone's like, read this wellbeing, do this meditation, don't forget to breathe. Are you eating well? Go and have a sleep. And you think, God, blimey, how do I sift through all of this? So if there's one thing that you have experienced or that you're doing that you think, I need to desperately share this with the audience today, what would that be? I'll let Shwea go first.
You go first.
So I think, Liz, you sort of unpicked this whole issue of living the pandemic as a frontline clinician, when actually, your focus is largely on how do I make sure I treat the next person in the best possible way? Because that's really when, most of our energy and cognitive emotion is all focused right now. And then you've got all of this stuff saying, I need to look after myself. I need to keep healthy. I need to be able to keep working. And, you're kind of like, I can't deal with this right now, because what I want to be able to do, I've got all this adrenaline, I've got all this positive energy in a way. So what I've found, and I find like a lot of our staff, our junior doctors, they're away from their families. They're living in hotels. On their days off, they're like charged up even on their days off. And I don't blame them for all the reasons that we've just discussed, including the information overload. And I found the one little thing that I've been focusing on is redirecting that positive energy. So there's all this energy floating about, and I'm trying to get them to focus on specific things, because I think as doctors particularly, they need to feel a sense of achievement at the end of that, something to manage all of this energy that's floating around, all this adrenaline. So giving them a little bit of projects, making sure that there's we're able to connect in some ways, but talking about a little bit of the literature, just discussing stuff. I mean, this is what they need at this stage. And it's just because I feel that there's all of this energy around that they don't know what to do with. It's a little bit ironic. And at that stage, if I'm going to talk to them about managing their anxiety or their stress, is kind of like really not what they want to hear. They want to be able to just channel that energy somewhere that is positive and productive and gets to something, and they can say, okay, at the end of today, I have achieved this. I think that's one thing. And the second thing, absolutely, we talked about the uncertainty of the information, the uncertainty of PPE and safety. And I think communication is absolutely crucial here. Ensuring that everybody feels, your team feels, that you're in this together. So certainly I've been trying at every single handover, maybe 3 or 4 times a day, we just try to regroup and talk about PPE, because that is absolutely what paramount people are feeling unsafe at work. And to say that we don't have the answers, but you know what, this is what I am doing today. Right? And I want to share with you, how I'm taking my gloves off and how I'm washing my hands. Like, I mean, just to reiterate to everybody, I am doing the same thing, and I am just as worried and scared. And I'm trying the hardest to ensure that we follow the guidance, but also do what we think is safe and right by our staff. And that I'm doing this with you. And I, wear the PPE that we're supposed to in this particular area, and wear the PPE we're supposed to in this particular area, and I'm doing that. So sort of, absolutely talking about PPE at every handover, I find, has been actually quite liberating. It's like you can see the shoulders drop. I mean, I've had staff come to me like in tears after that, after every session, saying, thank you for talking to us about it. We had that one training session and we're just like, go.
Yeah.
So anyway, I'll stop talking and let the rest of the guys pitch in.
In Australia, there was this incredible wave in the past 14 days of mental health clinicians, psychiatrists, literally hundreds that have reached out, some informal, structures, and others through 3 or 4 different groups that have come together, and we've now pulled them all under a sort of one banner to try and work out some different structures that are forming to look at how they might offer support. And some of them are already in organisations that exist, and others are forming through some volunteers, like literally hundreds of psychiatrists that have offered support. They're being led by some of the, premier and leading and very skilled psychiatrists. Others are psychiatrists that have expertise in disaster management and are guiding this process, and a number of registrars, and it's incredible to see. But, there's a number of different aspects to this, and it really depends, exactly as you're saying, on the phases, and it depends on where that particular clinician, or I have to say, not just us as clinicians, the staff members, our cleaners, our HR departments, they're going to see stuff that they've never seen before. We're going to see stuff that we've never seen. And the moral injury, particularly for our adult colleagues, is going to be huge, is already happening clearly in many places around the world. And so, I think that we're looking at it for all staff groups, and they're coming up with that over the next week and tapping into existing institutions or structures, but being able to give practical options for hospitals and link them in and wrap them around is really important. One of the things that struck me last week, which a couple of hospitals were doing, but not many, was how to lead in crisis. Some people I can see on the comments have said about it's like military. Yeah, it's like military. This is a bit of war zone of how we're trying to prevent as much PTSD as possible, how to lead and be calm, and how you cast your shadow in this crisis situation, and how you talk about PPE. Liz, I think in the past you've talked about sitting in the rubble with patients, but it's how you sit in the rubble with your team, how you lead your team, how you then as a leader get support. And so my thing, when you ask what 2 things, I think, the exec have done a lot of really great stuff at the Children's in Melbourne, but the 2 people I think of are 2 female leaders. I don't know if they're on tonight, but the chair of our medical staff executive, Medical Staff Association executive, Georgie Paxson, who's one of the MSA chair, has really led very exceptionally well and really brought the medical staff tight communication, lots of background, linking with our executive and trying to get that flow of information. A lot of work and a lot of pulling things together. And Sarah McNabb, who is the head of general medicine, the biggest department in the hospital, and has now refined our communication incredibly well, particularly around PPE, and is running the COVID respiratory clinic for the hospital. And that's been incredibly important for the junior staff, and that's been really impressive.
Great. Alys, do you want to tell us something that you think is going really well in your organisation, or something you want to build on?
Absolutely. I'm very, very grateful to the tremendous support in my NHS organisation, and myself and colleagues started writing a high-level overview briefing document, something like about a month ago, because we could see what was happening in other countries, and we recognised that frontline clinicians need to focus on their frontline tasks. So we've also commandeered a Twitter handle that was used for something else, and I'm very grateful to my colleague Linda Dykes, who some of you may know from Twitter, and we've now converted another a Twitter account, and we call it Staff Wellbeing During COVID-19, and that will be a safe place to get quality, the best evidence that we have to date information. So if you go on that Twitter handle, and it's at capitals HCW_welfare. If you click on the link, our main strategy document, which is as brief as it can be, it's about 4 pages. And what we've done, we've taken a strategic approach to the likely stages that people will find themselves in and the key actions for key people. So, for example, the executives have certain actions, that things they can do, and they need guidance too. So as an example, we have suggested that every executive or senior hospital managers have PPE as a daily standing agenda item on their daily meetings. So it's almost like a recipe for things you will consider. So I think that is good, and we've had contributors from around the world, and it's very much a team effort. And if anybody joining in today or yourselves would care to review and offer improvements, we will be incredibly grateful. We will be updating it. But can I just get you to stop for a second? Can I just clarify? Your Twitter handle for that is at capital letters HCW_welfare. Yes.
Okay, just so.
And when you go on it, it's green, and you'll see it's called Staff Wellbeing During COVID-19, and that has been tweeting about this meetup. But essentially, even though everybody's desperate to do something, the first premise has to be first do no harm. We then have to look at what evidence do we have. We have very little, but we have some. And I suppose that those of us who work in mental health at the moment, our biggest concern is that we ensure that staff wellbeing support and staff psychological support at least does not make any potential PTSD worse. And I suppose there's a real tricky issue here. And you find this when different colleagues come together very suddenly when they are time short. And there are currently misunderstandings about the term debrief. So we have called it something else. We have called it supportive team review. And that means that, and it has to be hot and cold, and you have to have a range of support. But basically, one-off emotional debriefing is likely to cause harm. However, staff need containment, they need support, they need to be reminded of things that went well, they need to be reminded of self-care. So to avoid any confusion, that's what we're calling it. So if you look on the document, I won't waste our precious conversation giving you the details, but certainly the other thing which I think is key is that if you ever heard me talking before, I do talk a lot about compassion. And I think this is the one time when we need to think differently. What we are asking frontline staff to do is a Herculean task. The range and number and severity of cases that we are asking them to look after does not mean that they can safely, fully engage in the backstory and the lives of every single person that they are treating under these extreme situations. To save more lives, we need staff to focus on the clinical task of the person they're helping right now, and then to move on as quickly and as safely as possible to the next clinical task. If to have real compassion, if you're some of you, I'm sure, are familiar with the Paul Gilbert model, there are 6 elements, and one of the elements is empathy. And empathy is the ability to put yourself in someone else's shoes, having walked their journey. How can we do that for every single patient, for every single relative, when we're not even allowing relatives to visit? So you can't tell people what not to do, but instead I'm saying, you know, can we think about capable calmness, where we are calm and we are capable and we do the job to the best of our ability, and kindness. And everybody knows what kindness means, and we need to go for good enough. And I suppose that I'm very keen that we convert our messages into bite size, because the most, you know, the geniuses of our world at the moment are struggling with information overload. Even the most intelligent, highly trained senior professionals will be forgetting to go to the toilet, will be forgetting to drink enough. And we have to go down to the absolute very, very basics in terms of our advice.
Tessa, I'm going to come to you next. Is there stuff that you're doing or that you are foreseeing, or there are gaps where you're working in terms of well-being that you think would be important to share?
So, I mean, I think there's two key things that are important. One is, I can see it's been mentioned in the chat, is some certainty, which just means some leadership from the people in charge, meaning like Shweta saying, regular PPE talks, a regular email update, not every day, but, you know, a couple of times a week or whatever, so that people know this is what's happening today. There is some certainty, even though everything's all over the place. But the second thing, I think, and it maybe ties in with what Alys is saying, we can't get involved with every patient, otherwise, you know, it would, you know, we wouldn't be able to cope, as in emotionally involved. But we can find connection with each other, and I think it's really important to try and find some way to connect with your colleagues, and that can be a formal thing that the department set up. It might be you just touching base with people informally on WhatsApp or chatting, but when you're in work, just to take some time to talk to people about how they are doing, you know, how are things going with your family, what are you actually worried about, and that just feeling that you've got some human connection with your colleagues helps to kind of, it helps me anyway, to kind of feel more grounded and more human while everything is kicking off.
Mary, I'm going to come to you. I guess everyone's been very much focusing on medical well-being so far, and we've touched a little bit about, you know, what happens to the nurses, what happens to allied health, particularly, you know, our nurses are often in rooms on their own for 12 and a half hours in extensive PPE. We've also got, you know, cleaners who have to, you know, make sure that they do a thorough clean before someone come in. We've got admin staff who aren't sure, like, when should they be wearing PPE. We've got allied health, physio, social workers, etc. You know, is there something in particular you think, do they need the same level of well-being, the same sorts of things, or do they need something different?
Well, I'll go back just a little bit to kind of answer that question. There's a thing that I always say, and that is, let's try not to leave anyone behind. And I think that's really important at the moment. I think we probably, you know, those who are on what we are calling the front line need particular sort of care. But everyone who works in a hospital that is under the sort of extreme pressure that we are seeing in some places in Europe is going to find that confronting. And the other thing that everyone who works in the hospital has in common is that they're all fearful. They might be experiencing anxiety and fear about slightly different things. But one of the things that comes up all the time for me when I'm talking to, whether it's admin staff, allied health, or clinicians, is there's also, I'm really worried about my parents. I'm worried that my parents are 90 years old and I'm not doing what I tell them to do, and I want them to stay in their house, and I think they're going to get sick, or I'm managing kids because the schools are closed, and all of these things are also things that we need to pay attention to. So what I want to say is, I love everything I've heard, but let's not forget about distributed leadership. There are lots of other people within the organisation, and this is a time for them to really rise up and start looking after each other. I think it's a dangerous time for us to cut loose with compassion. I think compassion now is vital. It's absolutely vital. Even the moment when we just put our hand on our heart, which we've all done just because we've been confronted with something and without even thinking about it, our hand will go up. Just in that moment of like noticing and then being able to let go and move on. I know that it looks like what the future holds for us over the short term is that people are going to have to move more swiftly from patient to patient, but we can do that with heart, and we can do that with love and care for each other. And the other thing that I think is great is giving people an opportunity to come together. So it may not be for I can't remember the term that Alys is using, but it was a great little term, I just can't remember. It may not be in a formalised sense, but people need, because we're now physically unable to come together, we need to find ways of connecting with each other. The other thing I just want to say, though, is I love what Shweta, when you said they've got so much energy and adrenaline is surging through them. Absolutely. That's why in any catastrophe, people want to get in and rebuild, do things, because we have to do something with that adrenaline. I would say this is a great time. People's gyms are closed, parks are closed, beaches are closing. Seriously, get people being active. Dance it out. Shake your entire body. Jog on the spot. Really get people to be using up that adrenaline. That's not something I would normally say, but in this case, I think the more we can actually move our bodies, the better.
I mean, I would just to say, I mean, again, it's a time to be thinking really radically differently. And if we're going to be in this for as long as one is expected, for example, 6 months, I've been thinking very much about, radical changes to rotas. And I think what you said, Mary, there is, I think that the rotas should mandate that there is time and space to do something physical. In a time when we're in such a restricted environment where actually that's not going to be possible to do in your personal life, perhaps. I mean, the rotas need to, potentially even be, we need to be looking pretty radically about that stuff, where we're asking people to work in very different ways. And we're going to have to experiment maybe in small teams. Again, time off is really hard for people, therefore, and they feel very disconnected. So I'm thinking very much about people who are off shift, whether we give them a string of days off and then they actually do something with their time to feel connected and contribute to the team. Give them a task. Hey, look at this particular piece of evidence and come back to us. Giving them a sense of control then as well, and they're contributing to making a change to the information, to how we manage patients. It's a very positive feedback. So I'm saying, actually, you got a couple of days off. I want you to read these 3 papers, and I want you to think about writing a method section for a study. I mean, this is medics all over. They feel like they need to do something in their time off and they don't know what to do. But this is, getting them connected, and then they feel, I've contributed something. So
you know what, Shweta? What about if we decided that the thing that they were going to do was actually something that they didn't need to use
their brain?
Mind. Yeah. So the actual team challenge is that we're going to run from here to wherever, collect our daily tally, or I don't know what it is, but anything that gets them there, everyone's up here.
Yeah.
And it's exhausting. It's totally exhausting.
Jane, were you going to say something then?
I do just want to say that, the thing that about this is it's going to be a marathon. One of the things is that it's coming obviously at different parts of the world at different times. In Australia, it's hitting us for winter and the lead into winter. I can see people commenting about, being worried about what we're going to be waiting for. As a rheumatologist, we're certainly worried about what people are putting off. And obviously as general paediatricians, you're worried about what people may not be coming in with and then presenting late. But I think for us as a workforce, we need to look after ourselves and look after our colleagues. One of the things we talked about preparing for tonight was thinking about also self-care, and a lot of clinicians have not developed that very well. And in particular, if you're in your house or your apartment, or you're at the hospital, depending how that's structured and set up, now is the time to start putting those yards in about your self-care. There's a lot of talk about sleep, and at the moment, the early phases, that is really hard. Trying to if you're having impact on sleep, thinking about sleep. So for me, sleep is the absolute foundational piece for this. Exercise, food, trying to think about, caffeine, all of that stuff, and starting to put those pieces in, because this is 6 to 12 months. This is a long haul. And so for me, I'd really encourage you, what are your personal support networks? How are you going to set them up? I think Tess has talked about buddy systems that you're putting in place. There's things that your organisation can put in place, but there's things you personally can put in place. I set up Zoom for all my girlfriends outside. One of them was a medicine, but girls I hike with. So we did Zoom, wine Zoom and cup of tea Zoom. I booked them for 30 nights. I just open it for an hour, but I made them all administrators. So it's set up every night for the next month. They're trying it. Some of them are dipping in and out. I'm not doing it every night, but we're doing it once a week formally with all 14 of us who can come, but the rest of them can just go in if they want to. So just to connect them as a community.
Yep. Tessa, were you going to say something? Oh, we've lost her. Are you there, Tessa? We've got poor Wi-Fi, I think.
No, you've not. It's just I'm muting. I am. Can you hear me?
Yes.
I'm just muting my mic when I'm not talking because there's background noise. I just wondered, there's a few people talking about on the chat about pediatric guilt. So it's not, I know not all the audience are pediatricians, but I think more than half are. And so I work in a joint up ED, so we're able to help on the adult side. But there's plenty of pediatric doctors who are feeling guilt because we've taken jobs in acute care, but actually pediatrics at the moment is pretty quiet, and the adults, our adult colleagues, are getting very busy and under a lot of pressure. And in some places, depending on your setup, you're not able to help. And that's, and then we start worrying about other things. Are they sitting at home because the kids are really sick? Although actually we've not got any evidence that that's the case, and it may be that we're just projecting one worry onto the next. What's from the, this is asking a question rather than answering one, but seeing as we've got you all here, what do you think, what advice would you give to pediatricians feeling that?
You've just lost you a bit, but I think the question was, what about pediatricians or any other specialty that, is watching their colleagues in the front line just thinking, what can I do to help? I feel so guilty. People are clapping me in the street, but I actually have never even seen anyone with COVID yet. I feel a bit fraudulent. Do people have any ideas about that, particularly our UK colleagues who are right in the thick of it already?
I just to say, I think that's a really good point. And I think just coming back to what you said, Liz, a lot of us as well, our numbers in the emergency departments have gone down significantly. And yes, we're seeing a lot of coronavirus. We're seeing a lot of really sick patients. We're doing lots of things that we haven't done before, but our numbers have gone down. And there are periods of lull still. I haven't been to work in the last couple of days, but up until then, we still had periods of a lull in the day. And one does feel a bit, oh gosh, we've had a tough winter and a tough summer as well, where we saw double the number of patients. And so, yeah, this sense of like being a bit of a fraud and imposter does feel real when you got all of London clapping at 8:00 last Thursday. But I think it's important to hold on to that. I think people have in healthcare been been feeling that they've not been heard and that they've been working relentlessly hard for a long time.
Their whole career. Yeah.
And it's okay. It's just come at a different time. Hold on to it, and it's fine to do that. And I think in some ways, there's a little bit of stuff that we need to hold on to now that we should think about in the after or the post-coronavirus era. And this is one of those. We've got a collective voice and a sense of renewed kind of fervor, as it were, within healthcare, and positivity that we need to then ride in post-coronavirus era. Remind our staff of how we came together in this time and what the public thought of us at that time, and therefore, what we now want to collectively do with that positivity and the energy that we have generated during this time. So I think there's lots of stuff, now that we need to hold on to for the latter part. That doesn't answer Tessa's question with regards to what do other staff do. I think, first of all, just, we've seen a lot of people just coming by and reaching out to us and saying, are you okay? What can we do? That's great. And I think, practically a lot of doctors want to know within their own teams how they can be redeployed, redirected, how they can help and support. And I think it's really hard to give a generic answer, but reconnecting and coming out of like different parts of the hospital down to the ED and ITU and saying, what is it that I can do, is it's an incredible feeling for the staff. That itself is a great start. And I think practically each team is going to be different. Each hospital is going to be different about what
we normally operate in such silos, don't we? Alys, you've been waiting patiently there. What were you going to say?
Yeah, I'll keep it brief because I can actually talk for 3 days. So I'll keep it brief.
We all can.
Yeah, I think, first of all, just in case anybody has misunderstood me, I'm not saying abandon compassion. I'm saying channel it to yourself and your colleagues and your loved ones. The other thing is, I love my buzzwords because people are so busy. We need simple concepts. So the next concept is I'm calling quality recharge. We have very little time off, and time off per se doesn't necessarily charge your batteries. You have to select something which is quality, ideally involves exercise whenever possible, because obviously we know the properties. And I think the other thing is that a lot of us, well, certainly I've been cross with myself. I'm not having perfect sleep because I think, oh my gosh, my lack of perfect sleep means that I'm lowering my immunity. I'm pushing myself at excess risk. It's not fair on my family and my patients. Do you know what? The other word I've got is let it go.
Yeah.
Don't beat myself up about not having perfect sleep. And if you really can't get to sleep, just maybe do some meditation. There's so many meditation apps and tracks. And even if you just get some micro sleeps, but if you take the pressure off this perfect sleep, and I think the other thing is for those people at different stages of COVID-19, if you're in the preparation phase, you need to be building your emotional batteries. You cannot function on empty. So you need to do everything possible. And I should have said possibly at the start of this meeting that I have 2 roles. I have an NHS role half the week, and the other half the week I work with colleagues in an organisation called For Mental Health. And I can't say too much, but very soon, I can't tell you when, but it's a matter of days or hours, there will be a new website launching, which has very practical, pragmatic, easy to read, digestible information about things we can do to help our coping and well-being.
Something I'm picking up is that some of you have really got this emotional focus on well-being, and some of you got a very practical focus on well-being. And we know from the research that some people actually do better with practical things, like give me something, I'll go and write a methodology, I feel better, tick, tick, tick. That actually can be a very medical way of thinking. I hate to be stereotypical, but that's what my own observations is. Whereas nursing, allied health admin sometimes tend to think quite differently. And some of you got a very emotional kind of way of doing it. One thing I want to pick up on is this quality recharge. Am I supposed to go away and do a methodology thing, as Shweta was saying, or should I be out in nature hugging a tree? I think this is so individual, and people have to have this acute self-awareness. But one of the things I've kind of been advocating for is, how do you have a micro recharge? So if I'm working a 14-hour day, what are the micro recharges that I can do for myself? And then what are the more macro recharges that I could do when I've got a whole day off? And one of the things I've had to say to some of my colleagues, this is my 1 day off. Please stop messaging me at home about things to do with well-being. And of course, do podcasts and blah, blah, blah. But how do you balance all those kind of things? So if we could quickly, I'm aware we've only got 15 minutes left. So can we quickly go around the group and say, what do you think you would be a good micro recharge for people doing a long day, and what might be good macro recharge? And especially if we're trying to think a little bit outside the square.
Just looking up out at nature. If you're sitting at your computer, or you come out of work and you look up and you see the stars, or you look up and see the sun coming up or the sun going down, those things are moments of micro recharge. They're very, very important. And there are all these other things. Don't take them for granted. The hot shower when you get home, you know, the soak in the tub, the telephone call with, you know, a great friend, telling hysterically funny stories. Is a real place at the moment for humour. And then when you're not at work, we've got to really become boundary ninjas. We've got to decide this is the boundary around my day off, and in a really loving way communicate that to the people who would contact us. So if your day off is about, I want to just be with my family, then do it. Just be with your family and recharge in that way.
Who wants to go next? Jane, I'm going to let you go next. I think these girls are very bossy. I'm going to let you jump in.
So I like Mary. I would say laughter. So I think laughter is a very, very good endorphin release. So because you've asked at work, I think that is a good thing. We use black humour a lot, obviously, in medicine, but surrounding yourself with colleagues that you can laugh with, or connect, you know, ringing someone that you can laugh with for a few minutes is very helpful.
It's a real psychological reset, isn't it? Even if you've only got a couple of minutes. I'm a big fan of laughing. What else, girls? Micro and macro ways of recharging.
It's really interesting for me. I found that I have become much more acutely aware of these micro moments than I've done before. And I don't know whether it's the world is pausing and therefore I'm just more listening to all of these. Like you said, the shower, which is like, you know, I've got this sort of routine about coming back home. Obviously, it's like, you know, my husband's at the door, making sure the kids don't touch me. And then I'm in my Corona bathroom having my shower. But that shower, as soon as it's true. I mean, you know, you worry about these things. And I'm in the shower, and that shower, absolutely, I have not, you know, it's my 15 minutes in there under the hot shower and just like, you know, no noise and completely, that's a great micro recharge for me. And of course, you know, the moments with the kids for me are really, I just feel like I've become more aware about these micro moments for sure. And just about, and then the macro stuff, I mean, I love the term quality recharge. And I guess that's what I was trying to say when I was saying about redirecting. Mm-hmm. And I think for me, it's about being utterly disciplined about what it is that I want to do, what it is that I need today. And some days it's mental. I need to redirect my energy because I have these questions and I want them answered. And you know, some days it's purely about physical, and some days it's both. But being very disciplined and setting myself what it is that I want to do, that is what I need today to recharge, and making sure I get that done so I feel better about it. And absolutely boundary setting. You know, turning screen time. So I'm being really mindful about and setting myself challenges of how much less time I can spend on the screen. You know, particularly when we don't have anything else to do, like, you know what I mean, go out and stuff. So socially, so I'm almost challenging myself to spend less time on the screen, on Twitter, on social media every day, and muting WhatsApp chats and that kind of stuff. So yeah.
Beautiful. Tessie, you've got a few kids, as I know a number of people on the panel does, as do I. How do you, you know, most of us, I felt pretty stretched before COVID. I don't know about the rest of you, but I thought life was pretty bloody busy before COVID. Do you have some suggestions about, you know, we've still got all of these demands. They haven't gone away. People have still got bills to pay. And, you know, when you're supposed to be making patty cakes or whatever for your kids, like how do you still find a micro and a macro recharge in amongst all of that?
I think it's really hard. I have not achieved perfection, so I'm not sure. But I think you know, we're at work, we're busy, we're stressed, we've got all these worries we've talked about, and then we come home and the kids are happy to see us. We're worried about, you know, getting coronavirusing whatever we've got, but and also just we want some downtime as well. But you're kind of but trying to balance that against having some quality time with your kids, and it's really hard. I don't think there's an easy answer. I guess the macro part is that has to be the priority. You have to, no matter how busy or stressful your day's been, you have to make the time when you're not on your phone or you're not checking things or thinking about other things, to spend it with your kids, because it's so important for them, because they've got all this uncertainty in their lives as well, and they're worried about you going to work as well, whether they tell you or not. You know, they can hear what's going on, they hear people talking. And with your partner as well, you know, making time when you're not just talking about COVID or thinking about COVID, to make that quality time. It's not easy, but we know it's going to be a long haul. This is not going to be over in a couple of weeks, and so I think we can spend time over the next couple of weeks working on that, which is what I'm trying to do, and embed that into your new life, your new routine. That has to be a priority.
And we just can't do it all. Like yesterday, I did some study. I wrote a research protocol for COVID-19 for staff wellbeing. You know, I baked some scones. I spent some time with the kids. I prepared for this. And at, 11:48 last night, as I was crashing into bed, I exercised. I thought, you know what, I pretty much nailed it today. And I came out and saw 4 baskets of unfolded clothes. And I thought, no, didn't nail it today. And I just think, oh, screw it. You know, like, this is the time that we can't be across everything, and you have to pick it. And for me, it was like, oh, well, everyone's going to wear, scrunchy undies for the week. Too bad. We've got to let some things go, haven't we? Alys, what's your suggestion?
Yeah, well, 2 things. One is organisations have a role, and I do think that they can try and, in work time, allocate tasks that are slightly less stressful on some days. And if you do something less stressful, maybe not in the red zone on some days, that will help. But in terms of quality recharge, I like to think I have a couple of emergency 30-second things I can do, but also things that I do more regularly. So a good emergency one is to access a happy memory. And there's actually research showing that calms us. So I would advise everybody to think of a really happy memory and give it as much detail as they can. Shut your eyes. What did you see? What did you feel? What did you hear? Who was there? What were they wearing? What were you wearing? And make that memory really, really strong. And then when you need it, if at work you become overwhelmed, you have rehearsed it, you can go literally just for maybe 10, 15 seconds. And you say, do you know what? One day this will be over. I will get my life back. Come on, I can do this. I can do this thing. And then you do whatever the task is. I would have a range of those. If you are really overwhelmed and you can't access your relaxing, happy memory, focus on the feeling of your feet on the floor. Just feel your feet on the floor. If it's safe to do so, maybe clasp one hand in the other, like a mini micro hug to yourself, and just say, I can do this. I've been trained. I'm going to do this. And I know it sounds incredibly basic and simple, but for anybody who's been in a really high stress situation, it has to be basic and simple and quickly done. And I would have a range of those. In terms of quality recharge, you should come and see my house. Or actually, maybe you shouldn't. I shouldn't be saying this live. I have abandoned all tasks which do not nourish. Obviously, it's not a dangerous place to be, but standards have dropped because myself and my family's well-being is more important than the ironing or the dusting. So simple things like that. Try, and you see, social media and the internet is a mixed blessing. And I don't mind admitting openly that there are times where I feel a little bit frayed at the edges. And anybody who doesn't, obviously, is, I don't know where they are. So I have stopped the news constantly. I've stopped constantly following updates. I do it just a couple of times. But what I do is quality connection with individuals and groups which nourish me. And please, everybody, if I can say one thing today, which is the most important thing, self-care is not a luxury. Self-care is not selfish. It is an absolute necessity. Yes, it is ventilators that may be needed to save lives, but just think who runs the ventilators. They're people. And we are the greatest resource we have against this. Thank you.
We're kind of running out of time. I can't see the chat and I'm too scared to touch anything in case I blow the whole thing up. Is there any questions that are pressing that anyone can see that we should probably address in our last few minutes?
There's not questions, but they've made some fantastic points along the side, and I think you get them, don't you, Tess, and put them into a bit of a summary.
Okay, terrific. So can you guys, if there's one thing you want people to walk away with, I think Alys has already said hers in terms of self-care not being a luxury. One brief thing that everyone wants to offer before I sum up. Jane, do you want to go first?
You know,
sorry.
Hi, Mary.
No, I was just looking at the comments and I'm just loving it. You know, someone's got singing the Pretenders hymn to her. I can't work out who it was they were singing it to, it, and pet therapy and things like that. These things are really, really important. Have also is smell. So when you have that shower, maybe there is a soap that you've always wanted to use, or an expensive, you know, body wash or something, and having things that you can smell, lavender somewhere that you can smell. These things bring us back into the present moment. So anything that feels like it's nourishing and a bit luxurious, now is the time. Bring it out and use it.
Beautiful. Jane, what can you offer?
We focused a lot on the self-care. I'm going to say, as people that I'm sure are involved with leading teams or in organisations, I think that this is the long haul. And so look around your team and your organisation and think, where are the gaps now? Because these are the times to push them. You know, are there places to sleep? Are there places where should there be links for accommodation? Have we got enough food and deliveries and, you know, links and all of those other things around the bottom of that Maslow's hierarchy? You know, you're going to have Alys's websites and links and other things. Is the communication adequate? And are you in the position to link in for your teams or your departments to try and support that better, or take that to your bosses if you're not a boss, because that is really critical for the long haul. We need to have that organisational structure and support. There are a lot out there in both countries, and I know we've got multiple countries here, but we've got UK and Australia represented in the panellists. We really need to do that, and we need to support all of the workforce, not just the clinicians.
Mm-hmm. Yep. Shweta?
I would say connection. I think it's so important and so fragile right now, making sure our teams remain well connected. There's so much of staff sickness. People are in one day, off for 2 weeks. There's so much changing. So communication and connection, and making sure you're constantly trying to bring your team together. Even if your sphere of influence is 5 people, just make sure you keep bringing them in. Because like you said before, Liz, we've always been bad at working in silos in healthcare, and we are at huge risk of getting much worse at this as this carries on through the marathon or relay, as it were, over the next couple of months. So constantly checking in and saying, are we connected with our teams? Are we making sure those who are not there today are feeling connected, as Mary said, leaving nobody behind? You know, so for me, I think it's just coming back to connection all the time, and that's through which we can get our communication right. We can make sure everybody feels they're in it together, and, you know, a sense of belonging and teamwork is like something we have to hold on to.
Tessa, you've got a few words before I have to sum up. What did you want to say?
Yeah, I think it's knowing that we're all in it together. So it's quite a unique experience, because wherever you are in the world, you're feeling the same thing. You know, me and Mary, we had a chat yesterday, and hearing what you're worried about, what I'm worried about, it's all the same, and that's actually quite unique. So just all the things that I'm worried about are the same things that you're worried about, or my colleagues are worried about, or my husband, whatever. And to recognize that and be open and talk to your colleagues about that. You don't just have to talk about PPE or flow. You can talk about actually how you're feeling, and that connection, like Shweta said, will help.
Okay, so if you are at home and you're going to create a wellbeing plan for yourself, grab a pen now, because I think these are the big take-home messages. Self-care, not a luxury. We are having a no man left behind, no person left behind. So whether you're the cleaner, the admin person, allied health, the nurse, you know, the retired person who's coming in, or a doctor, we're going to care about you, who you are in our team, and that includes our leaders. that communication is everything in this, and we need to do it in bite size, not to overwhelm people, and it needs to be repetitive. That some people will have a very practical solution to things, some people have it emotional. Our leaders have such a vital role in creating a system of calm, or almost a military style, very repetitive, but also that distributed leader, that you don't have to have a leadership title to lead while this is going on. People are going to fatigue, people are going to get sick, come in and out. We've got to use those people. It doesn't matter how long we have with people. Let's connect with them with heart. We don't have to completely empathize and burn ourselves out, but every interaction we have, either with ourselves, our colleagues and our patients, please have it with heart. Connect, connect, connect. Whether you need 40,000 people to connect with or 2, make it quality. Use your energy for good, not for evil. Don't overwhelm yourself with more COVID-19 on your days off. Have a great, happy memory. Make it full of detail. That could be a nice little micro break. Normalize emotions. Of course, you're going to be anxious. Of course, you're going to be fatigued and tired. This is going to be really hard work. Dance, jog, sing, bake, hug a tree, connect with nature. This is the time for radical thoughts. Please keep your clothes on at work, but that we may all need to be thinking outside our square. Please limit your screen time. Don't information load. There's no amount of information that you can put into your wee little brains that is going to make COVID go away. Savor things that are good and positive. Please laugh, laugh, laugh. Savor those things like people cheering us on, because there'll be times in the not too distant future we'll be on the front page of the newspaper again where they'll say, you know, we're all lousy. Quality recharge, micro and macro, and finishing off, be a boundary ninja. I love that, Mary Freya, where you just think, you know what, bugger off. It's my 20 minutes. You know, if you're peeing and someone's paging, they can wait. And I also heard there's no such thing as an emergency during a pandemic. So please put your PPE on, put your oxygen mask on before attending to someone else. We have had a little too fast and rushed for these glorious minds who've joined us tonight. Please give a virtual round of applause for our wonderful panel of Shweta, Alys, Jane, Mary, and Tessa Davis. Yay!
Thanks so much, Liz.
Thank you.
Thanks, everyone.
Guys.
Bye.